Welcome to the Hashimoto's Doctor Podcast. You're now part of a growing community of people determined to take their health back through education and self-empowerment. But because of the healthcare system today, we don't have access to the types of healthcare that we want. So we have to do things differently. We've got to do things smarter, and we do that by becoming our own advocates. This podcast will give you the perspective and thoughts of one of the world's leading Hashimoto's doctors. So let's get started. Hi everyone, Dr. Shook here. I hope you're doing well today. In today's podcast, what I would like to share with you is a continuation and expansion of one of my previous podcasts. What I want to talk about is the connection between suboptimal or not optimal, not ideal thyroid hormone chemistry and heart disease. And in particular, I want to talk about atherosclerosis or atherogenesis, which is basically the formation of arterial plaquing, and I also want to get into dyslipidemia, which means abnormal lipids, or like your cholesterol, your HDL, LDL levels being suboptimal or high or low, however you want to look at that. The connection, though, between thyroid hormone physiology and your lipids, your cholesterol, is well established and well known. This is something that we see clinically where someone comes in with high cholesterol. One of the things that you always have to rule out is, do they have a thyroid problem? That's something that's taught every doctor that deals with or learns laboratory analysis, is that hypothyroidism can contribute to and cause high cholesterol. Sometimes I think that there are nuances to this that are not appreciated. And what I mean by that is, so if it's, this overt hypothyroidism, you have, a TSH, which is typically how hypothyroidism is diagnosed, is high TSH. Your TSH is high and you have hypothyroidism, then the doctors will, make a connection and recognize that the cholesterol is likely being driven up due to the hypothyroidism. Okay. There are nuances to this that I think are not appreciated, where you may not have lab high TSH, but it's trending higher. It's above, what I would call a functional ideal range. It would be above, in my book, maybe above 2.5, whereas most labs they deem their high range for TSH is above 5, approximately, somewhere in that ballpark. The lab ranges, the reason I say approximately is because the laboratory ranges are different depending on where you live throughout the world. I mean, you're going to see that different labs use different ranges, and therefore you may get diagnosed in one area of the country as being hypothyroid, and in another area of the country you're just below their lab range, so you're not hypothyroid yet. And so depending on how your doctor looks at and interprets those laboratory markers, if they just strictly go by if it's lab high or lab low, then I think you may have suboptimal thyroid hormone physiology, and that is likely to contribute to suboptimal lipid physiology. So your cholesterol, your lipids may be altered or higher due to your thyroid hormone chemistry not being as good as it could be. And that's just looking at TSH as a way to try and understand thyroid hormone physiology and chemistry. The reality is that your TSH is one marker, and it's not a bad marker at all. It's an essential marker for getting an idea of your thyroid hormone physiology and the body's need for thyroid hormone. But it's definitely not the only thing that we need to look at and consider. Not by a long shot. We have to understand that the systems-based approach, where there's so many other things that can interfere with your thyroid hormone chemistry, and that can interfere. There are other things that can interfere with your body's ability to use your thyroid hormone, for your body to convert the hormone, to transport the hormone. All of the other things that we have to look at that are required to understand really what's happening and and help optimize your thyroid hormone chemistry. That's what I think we have to do to best, determine and I think optimize lipid chemistry. You've got to look at some of these nuances of the thyroid hormone physiology. So if the cholesterol is high, but the TSH is not lab high, so let's say it's just not above 5, but it's maybe at 4, could that be a problem? Could there be a potential issue? And I think that there's a lot of evidence that suggests that thyroid hormone physiology, if we're looking at just TSH, should be somewhere between 1.0 up to about 2.5. And some people will say, well, maybe maybe a TSH of 0.5 to 2.5 is more ideal, or 0.5 to 1.5. Here's what I think most people that are looking at this more critically and that work with thyroid issues quite often and considering it from a functional perspective, we think that ideal chemistry should be somewhere in a more narrow range as far as TSH alone. So could a TSH that is outside of the functional ideal, so let's just use the range of 0.5 to 2.5 as a TSH, could one that's above 2.5 but not yet lab high, could that be suggestive of suboptimal thyroid hormone physiology that's driving your lipids higher and potentially predisposing you to a greater chance of developing, atherosclerosis or heart disease? And I mean, there's more to cholesterol. Here's further nuances of this discussion. There's more to cholesterol than just the quantity of your cholesterol, and there's more to cholesterol than just the HDL and LDL, the high density particles and the low density particles. You've got to look at the size of the particle droplets. So typically you want the HDL, the high density lipids, to be high in number, and you want the LDL to be low, the lows to be low, the highs to be high. But the reality is that if you have a lot of you've got to look at the droplet size. So you really need to have an NMR test done. It's a where they apply a magnetic. They do an NMR test, which is nuclear magnetic resonance. So it's basically an MRI of the cholesterol, of your cholesterol, and it looks at the droplet sizes, and it gives them. It allows you to quantify the size of the droplets and whether or not they're the bad kind. To keep it very, very non-technical, we're looking for, if you have a lot of tiny, the small LDL droplets, that's bad. That tends to be a greater place you at a greater risk factor for cardiovascular disease, and it's much better than just looking at total cholesterol, or at your balance of LDL to HDL, is looking at the droplet size. That's where you're going to see, and have a better understanding of your predisposition to heart disease. Now, in combination with that, looking at inflammatory markers like C-reactive protein, especially C-reactive protein and homocysteine, are critical, because the inflammatory chemistry plus those suboptimal or altered lipid levels and droplet sizes can create a perfect storm for heart disease. And so the thyroid hormone physiology that's not optimal, if that leads to altered lipid physiology, right, like your cholesterol, and if you have even some genetic nuances like genetic polymorphisms, which are gene uniquenesses that we all have, that predispose you to altered lipid physiology, then we've got even bigger problems. So, taking this into consideration, looking at your thyroid hormone physiology is critical for overall health. I mean, there's so many, every single cell in the body is dependent upon thyroid hormone stimulation and optimal thyroid hormone physiology. It's critical. It's a critical aspect of your health, and I think it's something that could contribute to and lead to heart disease, especially with a few other factors if a few other factors are present, like higher inflammatory load and some of these genetic polymorphisms or gene uniquenesses, I think you could really be predisposed to some much greater risk of heart disease. So all things we want to take into consideration, and things that I want to make you aware of, because we know that suboptimal thyroid hormone physiology can contribute to dyslipidemia, so altered lipids and blood fats, which your cholesterol, triglycerides, and then it can also contribute to atherosclerosis. And when you combine those factors with higher inflammatory levels, you combine it with even genetic polymorphisms or gene uniquenesses, you've got a recipe for I think a much greater risk of heart disease. And that's what I think those are the factors that kind of have some of the greatest impact. So I hope this has been helpful. I know this is one that not many people are aware of, and it's a very, very important aspect of your overall health. I think it's an important factor to consider for longevity. Heart disease is the number one killer in the United States, and it's a major, major factor for optimal health. And you're talking about quality of life, because heart disease can lead to very poor quality of life as well before it leads to death. So these are all things that we want to consider, and I want to educate you guys on. So I hope this helps you out. I hope this helps you to better understand some of the ways that suboptimal thyroid hormone physiology can impact your body chemistry, impact your heart, impact your cholesterol and your lipids, and really help you to be better educated, because it's ultimately what I'm trying to do is help everyone to be better educated, be their own advocates, and be better partners with their doctors. And it's my mission to help one person at a time. If I can help you, I know that that's going to have a positive impact on your family, your community, and ultimately that affects the world one person at a time. So that's my goal. I appreciate you guys hanging out with me. If you keep listening, I'll keep teaching, but I look forward to seeing you guys on our next episode. Hope you have a wonderful day. Thanks. Thanks so much for listening. We hope you enjoyed hanging out behind the scenes with Dr. Shook. You can also talk with and learn from Dr. Shook through Facebook Live on our Facebook page at the Office of Dr. Brad Shook. Don't forget, you can also get access to our videos, guidebooks, and thyroid programs at www.drbradshook.com. Oh yeah, and don't forget one more thing. We can change the world one person, one family, and one community at a time. Until next time, remember, today is your day, and no one will tell you who you are and what you can be.